Hi, this is Samantha Littman doing the case study on periodontal disease in week 12 of Advanced Pathophysiology.
Good evening, Sam. I genuinely enjoyed your case study presentation on periodontal disease as it relates to our core studies. As you discussed in your presentation, periodontal disease can be attributed to numerous factors and could lead to other illnesses such as oral cancer. I was surprised at the article you discussed correlating stress to periodontal disease, but the evidence regarding the pathophysiology makes sense. Another factor that I have known to be a risk factor in the development of periodontal disease is diabetes. In an article by Bissett, Pomerantz, and Preshaw, researchers discussed how epidemiological studies have consistently reported prevalence and severity of periodontitis in populations with diabetes compared with people without diabetes. The risk of periodontitis is increased approximately threefold in people with diabetes, and the risk is even greater with poor glycemic control. There is even an increased risk of children with type 1 diabetes showing early signs of increased periodontal tissue destruction. Unfortunately, many diabetics are unaware that they have this risk for developing periodontal disease. It is important as practitioners that we share our knowledge of the correlation between the two diseases with our patients and advocate for routine periodontal assessments by dental professionals to assess for all potential oral complications associated with diabetes.
The case study that was presented involves a 25-year-old woman with complaints of gingival bleeding after gentle toothbrushing. Upon assessment, the border of her gingiva were slightly swollen and red and had blood oozing from the gingival border, and the teeth were covered in plaque. The patient was instructed to keep her teeth clean. However, several years later, severe gingival retraction is observed, and the upper parts of her tooth roots are exposed, and some teeth are mobile. Periodontal disease is an inflammatory process that affects the supporting structures of the teeth, alveolar bone, and cementum. It ranges from gingivitis to periodontitis. Periodontal disease can lead to the destruction of the periodontal ligament, which attaches teeth to the alveolar bone, and leads to loosening and eventual loss of teeth. Poor oral hygiene, which changes the oral flora in the mouth, is believed to be important in the pathophysiology of periodontal disease. The first article in this case study is a study that is looking at the relationship between periodontal disease and the risk of oral cancer. The researchers in this article did a meta-analysis of 11 case control studies looking at the relationship between the periodontal disease and oral cancer. The article states that about 75% of oral cancers are associated with poor habits such as smoking and alcohol consumption, as well as poor oral hygiene, poor nutrition, and some chronic infections, all of which also contribute to periodontal disease. The researchers found that the risk of oral cancer increases by nearly twofold in those with periodontal disease. The second article in this case study is on stress and periodontal disease. The article defines stress as a physical, chemical, and emotional response that causes bodily or mental tension and may be a factor in disease causation. Stress markers chromogranin A and alpha amylase have been found to be higher in patients with aggressive periodontitis compared with healthy individuals and those with chronic periodontitis. A correlation has also been found between work-related psychosocial and psychological stress and the progression and degree of periodontitis. One study found that stress and increased levels of cortisol and interleukin 6 and 10 in saliva correlated with an increase in plaque accumulation and gingival inflammation. In another study, they compared periodontal disease between 22 dental students in their final year preparing for exams with 29 dental students in their first year not taking exams. This study found stress to be influential in periodontal disease that should be addressed before treatment. Stress is influential in the pathogenesis of periodontal disease, which can affect the severity of the disease process. The final article of this case study is on host genetics' role in the pathogenesis of periodontal disease and caries. The study looked at the evidence regarding host genetic variants contributing to periodontal disease and caries, also known as cavities. 124 studies were reviewed, 59 of which were on periodontal disease and 65 were on cavities. Several gene variants were found and showed moderate to strong evidence for an association with periodontal disease. However, none of these were found to be associated with the caries trait. Single nucleotide polymorphisms in the vitamin D receptor gene were associated with periodontal disease in several candidate gene studies. Single nucleotide polymorphisms were also found in the interleukin 10 genes that were associated with periodontitis in the candidate gene studies. This study shows that there are genetic roles in periodontal disease formation.